The Church in the 21st Century Center was established 12 years ago by Father Leahy, our president, and has a mission of being a resource and catalyst for the renewal of the church. One of the things we do each year, and I hope all of you are both aware of it and have received copies, is each semester we publish a magazine on a particular theme. The theme of the magazine for the fall was The Poor, What Jesus Preached, and What the Church Teaches. And we've had a series of on-campus events which reinforce that theme. And tonight we have a distinguished panel that will address one aspect of that theme. My job is about to be completed as I introduce the distinguished dean of the school, Graduate School of Social Work, who will introduce our distinguished panel. So, Alberto Guidenzi, our dean.
Thank you so much, Bob. Bob Newton fills in all the voids. When an interim post becomes available, Bob is there. So we just talked about this. When I step aside, Bob steps in, and he cleans up the place. So that is the plan. So thanks so much, Bob, for introducing us. Thanks to Karen Kiever, the Associate Director of the C21 initiative. It's a very important response to the clergy sexual abuse crisis back in the beginning of 2000. And it has been a very lively conversation and dialogue, inviting all kinds of conversations that are really enriching our dialogue and competence and knowledge about issues that matter to the church. I just heard from Karen that yesterday evening they had a student event, 500 students who were engaged in a conversation with Michael Himes on issues of family. That's the kind of things I think the university should be engaged in, so I'm really pleased that this is happening. And tonight I have a wonderful opportunity to have a very distinguished group of panelists here with me to talk about this question. And this happens in the university, these things happen. You get a phone call, and Eric Goldschmidt calls, the former director of C21, and says, Alberto, this was probably sometime in April or so, could you please chair a panel on, is there a future for Catholic health and social services? And I said in April, sure, yeah, I can do this in November. What do I know about November? And I didn't even care too much I didn't look at the question clearly enough. And I said, I'm going to do this. Then Eric comes by and says, by the way, I'm leaving C21. Why don't you do the whole thing? And then I said, okay, let me look at that question again. Maybe I need someone else. And then I found out in the weeks and days to go to this event now that some people said, why did you choose that question? That seems like a silly question to me. Is there a future for Catholic health and social services? Of course there's a future. Say yes and go home. But okay, let me think about that question a little bit. And though it may seem a rhetorical question, it actually isn't at all, from my point of view. And I think that's the conversation we're going to have tonight. Because you could ask the same question. I think it would be an interesting conversation, especially with Father Monin here present. Is there a future for Catholic universities? That'd be an interesting question, right? Things to think about. There's some universities, Catholic universities, that have a hard time surviving in this climate. So it'd be a good question to have. What distinguishes us? Do we something different than the other universities that are not religious? And the same question you can, of course, ask about health and social services agencies. What do they do differently? Do we serve a different clientele? Are we more efficient or effective? Do we have a smaller overhead for administrative costs? What is different in what we do that distinguishes us? Do we present ourselves more attractive to potential funders, individual donors, federal funders, foundations? These are very important questions from my point of view. And going forward, you may think, yes, the answer is yes, but we need to think about the added value, the value proposition of our agencies, and then we can probably have a better and informed conversation about this. So I'm really pleased to have this opportunity tonight. The way I would like to organize this as the facilitator of this conversation is that we engage for about maybe half of the session with questions that I have prepared to the panelists, and then I really want to open this. I don't want to have an evening where we fill 95% of the time and then say, are there any questions? And then you're either asleep or you think, okay, this is not serious. And so after about half of the time, I'll interrupt and then we can have a conversation. And if you have a burning question in between, feel free to raise your hand, chime in. Don't heckle me, but chime in, and I may either engage or not. But this should be a lively evening, hopefully. Again, I have the wonderful opportunity here to have an amazing group of panelists. To my immediate left, Michelle Bremelsik is an international development specialist with 20 years of experience managing multinational, multifunctional teams in resource-poor settings. She has been with CRS, Catholic Relief Services, a huge organization which we partner with. We're very happy about to partner with them. Since '95, working in over 100 countries across the world, and currently Ms. Bremelsik serves as Vice President for Overseas Operations. So that's our first panelist with an international perspective and international focus. Almost like the twin to the international focus, of course, we have the US focus. Okay. And this is Father Larry Snyder, who is president of Catholic Charities USA, the national office of more than 160 local offices. And since joining Catholic Charities USA in 2005, Father Snyder has been responsible for leading the overall direction of the Catholic Charities movement and the strategic leadership of Catholic Charities USA. It's a very important job, and the schools of social work are actually very happy to be able to work with Catholic Charities, both on the local level and on the national level. And then finally, on the further side of the table, Father Brian Hare is the Parker Gilbert Montgomery Professor of the Practice of Religion and Public Life at the Harvard Kennedy School. He is also the Secretary for Healthcare and Social Services in the Archdiocese of Boston. He served on the faculty of Georgetown University and the Harvard Divinity School. And I asked myself, why not at BC? But we have a conversation about that later. Father Hare was also extremely helpful to me when I once had a crisis in my school. I have almost every week a crisis, but there was one once a crisis, and then we reached out to him, and he helped engage with students and faculty about the process around an issue that was very sensitive. And we talked about it, an issue actually that we can discuss probably tonight in other forums. So this is our panel. And I'd like to start with a question where you would be also invited to talk a little bit first about your current role that you have in the institution. But the question would be, how do you see your respective role in your institution as part of the core mission of the church?
Okay.
May I start with you, Michelle?
Sure, love to. So just to make sure I clarify from the wonderful introduction, I haven't worked in 100 countries personally.
I know.
Okay, so just I mean, it'd be a little hard to fit in, but
97, right?
yeah, it's a few, right. Maybe about 5 or 6, but I certainly have traveled to more than, but not quite 100. So please don't give me that credit yet. So I really appreciate this opportunity to come and speak about, well, what is Catholic healthcare and what is the future? And I love having the job of covering the rest of the world. So you get the Archdiocese, and then you get the U.S., and I'll do as much as I can to bring the story of what we've seen overseas in our work into this conversation. But definitely, I would say, as a person who has spent my life as a Catholic and believes very much, I think, in the vocation of how you follow where you're called, that very much I see my role in CRS as part of the core mission of the church. I started out my career in Catholic campus ministry, and I was sharing with a group of students today that, well, it wasn't really my calling because I was looking for something where you were doing more active work. I didn't have the patience and the ability to trust in the future, but I wanted to see things happen today. So I have that joy of being in a job where we are about today. So when we wake up in the morning and show up at CRS, or sometimes in the middle of the night, it is about what are we doing across the world in all the time zones to respond to those most in need, whether it be in emergencies or in development. And certainly we see our role in CRS about being part of the new evangelization, being that witness to what does it mean to share the love of Jesus Christ. What does it mean to be in that moment when people are most in need, and to be in that relationship, bringing them both hope and hopefully interventions that will transform their options and their lives. So I see that very much, and I thankfully with Pope Francis speaking about this as a core value of who we are and who we are as Catholics, I think it's an easy sell to answer this question. So thanks.
Okay, thank you so much. We go to Father Snyder.
Okay. Well, I will echo Michelle's answer and say that Catholic Charities, of course, also thinks that it's very core to the mission of the Church. And Catholic Charities has been active in the public square in this country since its inception. And we trace our beginnings back to the year 1727, when a group of 12 Ursuline nuns left Paris and came to this country. Well, it wasn't this country, but to this land, to the city of New Orleans in New France, and began ministering to the needs of immigrants there. And so that kind of was the way Catholic Charities began. And one of the things we should remember, I think, is that for the majority of our history, we Catholics in this country have been an immigrant church. It was well into the 20th century before the majority of Catholics were actually born in this country. So our roots are very much the roots of people of our faith coming to this country and needing services. And so that's kind of where we began. And in many ways, I think what we do is correct the marketplace, because the values of our faith are not always the values of the government. And so there are issues and people that get left behind that we at Catholic Charities then try to pick up. At the same time, I think we've seen ourselves as partners in the public sphere. When you look at our funding sources and all Catholic Charities across this country, we have a budget of about $4.3 billion, but 60% of that money comes from government funds. And some folks think that, oh, that's a fairly new phenomenon. Well, not really, because if you go back to the very first federal grant that was given to a nonprofit, it was given in the year 1871 to the Little Sisters of the Poor in Washington, D.C. So that began a partnership that continues to this day of working with the government in a way where and when our missions of protecting the common good actually intersect. In that history, there have always been challenges, and we have always, to this point, found a way to work through those challenges. And so I very firmly believe also that there is definitely a future. But just a couple of words about why I can be bold enough to say we are definitely a part of the core mission of the church. It's rooted in the Judeo-Christian concept of charity. We've got that in the Old Testament with the prophets and the widow, the orphan, the stranger in our midst, and how we treat those folks, the marginalized, is how we will be judged as a society and as a church. And you get in the book of Proverbs where an act of kindness to a poor person is actually an act of worship. So that's the tradition we come out of. Of course, in the New Testament, it's a much richer way of looking at the parables that Jesus gave us. But to jump ahead to Pope Benedict XVI in his first encyclical of Deus Caritas Est, said that there are three things that are constitutive of the church. And one is preaching the word, the second is celebrating the sacraments, and the third is exercising charity. And that if you're not doing all of these, you cannot call yourself the church. And so it is constitutive. And I think Michelle referenced Pope Francis. And again, what he has done, I think, to remind us that we are a church first and foremost on mission. That he calls us a field hospital. That resonates with those of us who work in Catholic Charities. He says we should go into the messiness of life. That resonates with the work that we do. And just one final thing is that when we were formed as a national organization in 1910, our charter told us it's not enough to simply provide services. You must also be the attorney for the poor. You have to advocate as well. So kind of bringing charity and justice together, saying you have to be the voice for those who have no voice, And that's an integral part of your responsibility. So we will remain active in the public square, and I think there is a future.
Thank you so much, Father here.
Yes, yeah, I'm delighted to be here. It's always an honor and fun to come to Boston College, so it's enjoyable as well as productive. When I saw the question we were going to be asked, how do you root your work in the core of the church, my life has been, I've been ordained almost 50 years now, and so over those years I've had the opportunity to work at Catholic Relief Services, to work for Catholic Charities nationally, and then now I serve on the Cardinal's Cabinet for issues of health and social service. So I oversee 5 social service agencies that report through me to the Cardinal, and then relate to 3 Catholic healthcare systems on questions of Catholic identity. I think the easiest way to root all that in the life of the church is to think for a minute about the 2 central documents, I think, of the Second Vatican Council. The first one was called the Church. The second one was called the Church in the World. Yes. And the document, the Church in the World, next year, 2015, will be 50 years old. So the way those 2 documents examined the church was that the first one, the church, looked at the internal life of the church. It was concerned about our worship, concerned about our teaching, concerned about how the various parts of the church fit together. And Catholicism has a very developed fabric of how to understand the meaning of the church. So that document was taken up early on, first session of the council. After 3 months of debate about that and about the document on liturgy, the church's worship, after 3 months, a group of bishops stood up at the end of the first session after 3 months, and they said, basically, everything we've talked about here is necessary. You can't be Catholic if you don't understand the internal life of the church. You can't be Catholic unless you celebrate its liturgy. But they said, it's not enough. The world, they said, wants to know what the Church of Christ is for the issues that resonate in that world. It is interesting that the Second Vatican Council began a week before the Cuban Missile Crisis. Mm-hmm. And all of a sudden, a church that was immersed in thinking about the church had to worry about a world that had the capacity to end all of life in a half an hour. And so they said, we've got to be able to say something to the world about what the Church of Christ is in a world where war threatens devastation. We've got to be able to talk about what the church is in terms of human rights and human dignity and human welfare. And so out of that came a whole reflection on the church in the world. Now, I think Catholic healthcare, social service, and Catholic education, I call the 3 of them together the Catholic social system. Out of one church, we run basically sponsor, support, however you describe it, the largest private school system in the United States, the largest nonprofit healthcare system in the United States, the largest social service network, and I think the second largest relief and development agency. That all arises out of one community. And so those things are, I think, the way we answer the question of the Second Vatican Council. What does the Church of Christ think about healthcare, social service, social welfare, humanitarian relief and development? And the final thing I'd say is the way I think of those institutions is they are bridge institutions into the life of the society. In other words, what we try to do in healthcare, social service, and in international relief and development, what we try to do is take the resources of the church and connect it to the wider society and put them at the service of the wider society. That sounds to me like it's a pretty core idea of what it means to be Catholic.
Okay, thank you so much for this initial round of thoughts that you had to this question. I'd like to follow up on one thing before I go to my second set of questions, which was that you, Father Snyder, mentioned that from the $4.3 billion, 60% come from government funds. At the same time, you said that your values are not necessarily the same as those from the government. And I am aware that some social service, health, and relief organizations refuse to receive funds from the government for various reasons. Some legitimate, some we may not understand. But do you see any friction, any tension there? Or do you see this? I mean, the government obviously trusts you, provides you a lot of funding. But go ahead, please.
There's definitely friction, and there's something that we have to always be very careful about. But I would say, too, that first and foremost, these are contracts, they're agreements, and nobody forces you into an agreement. So both parties have to agree to all of the details there before you would actually enter into that agreement. Now, like I say, there are some things in our teaching that prevents us from doing certain things, and so we have to be careful that we stay within our parameters as a Catholic organization. And I think for the most part, the government respects that, at least historically, that's been the case. But it's interesting when you talk about there are some organizations that refuse to take government money, which I find odd. Some of them say that it's somehow tainted money. Well, it's our money,
Yeah.
you know. And
You're paying taxes.
but the other thing is there are a few bishops who will not let their Catholic charities take government money. But here again, I find it very interesting that they are the same bishops who are promoting taking vouchers, government vouchers for Catholic schools. So I think there's a little inconsistency here. You can't do it for the poor, but we can shore up our schools with the money. So I just bring that up, that we need to be consistent in our thought.
And has the government, by providing these funds, ever had any restrictions on, or I asked you, why do you serve certain population or provide certain services or not? Has there ever been a conversation about that strings are attached to those funding?
Well, I think there's always a lot of conversation, actually. But they know that there are certain things that if they require them, then Catholic Charities cannot, in fact, enter into that partnership.
Okay. Michelle, do you have the same funding, I assume?
Yeah, I think it's a good question to ask. So for CRS, we have an annual program value somewhere between 600 to 700 million a year over the last couple of years, and of that, probably 450 million would be U.S. government funded, and then we receive funding from a variety of sources, including Catholics and people of goodwill from the United States who are amazing supporters of our work. And this, if we talk about healthcare, we're really getting into the heart of the challenge for a Catholic organization, because you certainly are going, as CRS, as part of the U.S. Bishops' Conference, we are with no problem fully within the U.S. Catholic Church's teaching and policies on how we do healthcare services, whether that be not providing artificial contraception, whether it has to be with HIV prevention. We are very clear with our staff, and our staff are not all Catholic, so we have a lot of training programs to help them understand what is our position and why. And of course, there are ongoing dialogues with the U.S. government about what it means for us to be doing their programs. And when we apply for grants, we're absolutely clear. We say, this is who we are, this is what we do, this is the evidence to show the results of the great programming we do, but we're not applying for funds that have to do with anything we won't do. So we're upfront, we're transparent, we embrace the wonderful results of the programs that we offer. And I feel personally very much that it is very important for the church and our work, especially in healthcare, to be part of this dialogue, to not be silent, to not be absent. I mean, when you're in a conversation about with organizations who believe that the only solution is to ship huge amounts of appliances and medication, and you're trying to say, look, the real issue is whether the husband and wife can have a good discussion. The real issue is the marriage, and whether that marriage is supportive of the family and supportive of the children, and you're able to have a discussion. And I think that's an amazing part of the conversation that has to come in as a Catholic organization. How do you think about family? How do you think about community? How do you think about the role that we play in providing diversity? If we're absent from that conversation, then who is talking about that important piece of our work? So I feel very passionately that it is not just that we say we don't do things, but what we say we do things. The things that we do are important. And if you don't have a knowledge of that, then, and if you don't have someone in the conversation, then those conversations don't happen. So it's, I think, even more important that we of course have to stand up and say these are things, they're things that as a Catholic organization we will not do, but even more to be in that dialogue about how impactful good programming is on communities and families.
Okay, and are you saying that some of the things, I like that approach, this is the things that we do. Are these things that you do different than what other organizations are offering in the market?
So I think that's always the challenge for a Catholic organization, is we like to maybe sometimes put our light under a bushel. We don't like to talk about what we do. We don't like to actually really think carefully and articulate what we do. But that has been, as the US government has become more and more of a challenging partner, we have had to get much better at understanding the evidence. So not just talking about anecdotes, not just saying this is a good idea, but it's a good idea because we actually go out and do the research to understand the impact of our work. So we say, yes, it's good that a husband and wife talk and understand and make choices together, both about finances and about their lives and about their children. But let's actually go out and talk to those couples after we've done the training and find out what's changed and see if domestic violence decreases in that relationship and see if their girl children are now going to school and be able to talk about that. So I do think that the issue here is not just to also have the position, but to have the evidence and the real results to be able to be in a conversation that is about, yes, we do this because it's important and it has these results.
That's of course where universities can be great partners for organizations such as CRS, and some of our faculty are here who collaborate with CRS in very fruitful ways. So it seems like all panelists answered, not surprisingly, yes, there is a future for health and Catholic oriented organizations and ministries. Now, can you talk a little bit about potential challenges that you see ahead or are present already in terms of, I'm not talking survival, but in terms of growth, sustainability of your services?
Well, my answer to the question is yes, there's a future, but it's complicated.
Okay, can you talk about the complications?
There's no free ride here. There's no free ride for lots of different reasons. So the way I think about Catholic social service agencies is I draw a square, and I put the agencies in the middle of the square, whether it's healthcare, social service, humanitarian relief and development, or Catholic education. And then from the center, where I put the institution, I draw a line to the four corners of the square.
Okay.
How you relate to the community of the church is the first question.
Okay.
How you relate to the state is the second question. How you relate to the courts and the legal system is the third question. And how you relate to those you seek to serve is the fourth question.
Okay.
Each one of those questions has its own complexity, and each one of those questions poses a kind of challenge for these institutions. So, how we relate to the community of the church. If we don't reside within the community of the church, we'll lose our identity. But residing within that community is a two-way street. How we invite the larger community to support these institutions, and how the larger community sets the expectations of what kind of performance we have to fulfill. The relationship with the state, the Catholic style of relationship with the state is engagement. Okay. We neither run away from the state nor we marry the state. We can't do either one of those. We need to relate structurally, engagement. We have a whole history of church-state teaching that allows us to do what Michelle was talking about. You can enter the dialogue with the state. You neither get lost nor you run away from it. But you need to be able to say yes and no. Be able to say yes and no. And therefore, it takes a certain set of standards for you to decide how you say yes and no. Thirdly, how you relate to the courts. This is an increasing challenge. It is not simply a matter of government policy, where when it's a matter of government policy, you often have more than one road into affecting that dialogue. You can deal with the Congress, you can deal with an administration, you can deal with state legislators. You can use a whole fabric of relationship. But the courts are another question. You enter in and you get a yes or a no.
Can you give an example?
Well, sure. There's a whole range of examples in terms of health care. The 1973 decision on abortion set immediately a limit on what Catholic hospitals could do in that area. We've just seen in the past month 2 different sort of almost fixations on how Americans think about death and dying. You had a report at the beginning of the month from the National Institutes of Health. It's about a 500-page report called Dying in America. And what that report is meant to do is to highlight how frail the support system is for families and individuals in the last chapter of life. Palliative care, for example. Palliative care is not covered by health insurance. That means lots of people don't have any chance to get palliative care whatsoever. Hospice care is covered by health insurance. That's the kind of dialogue you enter into with the state and with the public arena. So so you ask about the courts. Abortion was one. Obviously, in this state, we had a huge battle on physician-assisted suicide 2 years ago. That question has already gone to the Supreme Court once. It lost. In other words, the 73 decision on abortion said abortion was a constitutionally protected right. There was a proposal in 1997 before the Supreme Court that assisted suicide was a constitutionally protected right. It was turned down. It will come back. Because the second thing that fixated our attention, obviously, was the tragic case of this young woman, Brittany. And it isn't Brittany. It was Brittany. She had to make her own choices. You needed compassion and empathy and prayers. But the organization, Compassion and Choice, is the driving force behind Brittany's story. And that organization is nationwide. They are into the question of this. And they will either go the legislative route, or if they get enough cases, they'll go legal. So from womb to tomb in healthcare, you've got court decisions that can touch. You also can have court decisions on questions regarding funding. So the courts are the third area. So the church, the state, the courts, and then the constituency we serve. How do we keep our eye on the ball? The people who are in poverty, who are in conflict situations, who are in dramatically different situations requiring healthcare and social service in this country. There's one range of issues. There's a whole wider range of issues that Michelle talks about. So that's the reason we're in business, is that constituency. But the other 3 factors can set limits, obstacles, and challenges as you try to carry out that ministry to that 4th group.
Excellent. You really should think about moving to BC. I can't see it. I like his lectures. Responses from you, Father Snyder, to this question of challenges or opportunities looking into the future?
I think there's a long list of challenges that we could make. Some of them that we face at Catholic Charities and in social service delivery, I think, is first of all the economic realities that our country is facing right now. The fact that we have a very large number of people living in poverty, nearing, as high as it's ever been, with fewer opportunities to get themselves out of poverty, if you will. We have a shrinking middle class, which impacts this as well. To that, I think you have the demographics of an aging population And for those of us who are in Catholic services, the Latinizing of the church with the number of Latinos, and reduced funding from the government. A huge problem is the politicization of society. So you have pretty much a logjam for the last 6 years in Washington.
Right.
We haven't been able to move anything through. And with that are two very different attitudes toward the poor. There are those who blame the poor that what is there is in fact some personal defect, bad decisions, and other folks who say, no, it's purely systemic. And the fact is, it's both somehow. We can't leave either one out. But they politicize and polarize these things. I think we also find it in the church. Again, a polarization. There are issues that should, in fact, be very easy for us as Catholics. Immigration is such an issue.
Right.
The bishops have been very clear. The Pope, the Holy Father, has been very clear about it. And I think we hear a lot about it. And yet, the latest polls that I've seen anyway say that Catholics favor immigration reform at a level that is less than the general population of this country. And to me, that's just a very hard thing to reconcile. Then I would say there's also the issue that we have an ineffective social network, safety network in this country. What we do, and Catholic Charities is a very integral part of it, is critical to millions of lives and needs to be there. But are we simply helping people survive, which is what I think we're doing, or are we really going to try to help people get out of poverty, which would bring in a whole different set of goals and strategies and program designs than we're doing right now. So that's some of the challenges I think that we face.
Now, Father Snyder, you chaired a whole initiative around poverty. So I assume you didn't just go after survival. You had all kinds of other plans. And can you talk a little bit about that, how effective that was?
Well, I'm not sure how effective it was yet because we're still talking about it and we're still trying to get some movement. I think, I can see that there are certain of our agencies that have in fact redesigned their whole program delivery using these kind of strategies that we have, and it's been very effective.
Good.
Because our agency in Phoenix did an analysis, and they said that 75% of their programs were actually helping people survive. 25% were the bridge out. And their board made a conscious decision that 5 years from now, it's going to be just the opposite. And that seems like it's kind of a tough decision to make. We're not going to leave people behind, but I think the only way we're going to get people out of poverty, though, is to do that. And we looked at strategies, which I don't think we want to get into all of them tonight, which I could go on and on about. And I think that we are trying to prove that, in fact, that if we change certain strategies that we have, it will have a definite impact on the people that we're serving.
Okay. Thank you so much. Michelle?
Yeah, I'm trying to think about a way to talk about the challenge of the overseas health structures. And I guess it would, maybe I'll take a step back and talk a little bit about our history in healthcare, because I think that will help understand maybe what we're seeing as some of the challenges for health overseas and health services. So up to about maybe 10 or 11, 12 years ago, most of CRS's work in health was about community support. So it was very much about how do you help a mother do growth monitoring of her child? How do you help women get to the hospital to deliver? Very, very community-based services, usually public health. So how do you get people access to treatments, but you're really helping them bridge what's going on in their community and getting them to services. We didn't really have much of engagement as an organization globally with healthcare in facilities. What changed about our intervention 10 or 11 years ago was HIV/AIDS. So as an institution, we had to decide that there was no way as a Catholic organization that cared about the poor and vulnerable, that we could remain outside of the needs, the desperate need for services for HIV/AIDS. So I was sharing the story with others here on campus today about my own experience. So I showed up in Zambia, in Central Africa, in 2001, before PEPFAR and all of those wonderful government programs for HIV/AIDS were started. And at that time in Zambia, the population was 12 million, so very, very modest. The country is large, about twice the size of California, but a very modest population. And they were losing 300 people a day from HIV/AIDS. You can imagine that kind of numbers every day in and day out, being buried, dying, overwhelming the health system. And CRS really was only able to work with the church and help people die with dignity. And at that point, you're like, that's not enough. That's not enough for what we should be doing. So the US government started offering funding for HIV/AIDS, and we applied. We had a global grant for HIV care and treatment that ended up doing some incredible work because of our local partners on the ground. So our local partners on the ground overseas in health services are usually mission-run hospitals. That means they were started, usually during colonial times, by religious orders who were doing missionary work, very similar to the beginning of Catholic charities. They were religious sisters or brothers or religious men's orders that were about going out and evangelizing, but also realizing that you had to provide social services. And in most cases, the colonial powers would not allow them to have hospitals in capital cities because they wanted control over the capital city, and they saw the Catholic Church as maybe a destabilizing revolutionary force. So they said, no, you have to go out to the countryside. So these hospitals were often in the most remote parts of the country. So as we started to do care and treatment around HIV/AIDS, we were going to those hospitals and helping them take the transition of really being primary care facilities to really fully functioning facilities that can do HIV care and treatment. You have to have a functioning laboratory. You have to have a functioning pharmacy. You have to do electronic medical records. You have to have trained staff. So that made a huge jump for those facilities to really be able to provide that kind of quality treatment. But what we started seeing that is, I think, at the heart of this challenge was that these facilities were in the same demographic transition as the church everywhere, which was that those missionary organizations that had started this work, had sent sisters and brothers and priests out to run these hospitals, were getting as old and elderly and had been there for 30 years and were having to shift to newer indigenous women and men from that country who were now part of those religious orders. But they no longer had the connection back to the developed world for funding. So this was like, you're sort of watching a whole health system on a precipice because, they were doing wonderful work. They were doing great great services to the most poor and vulnerable, but they didn't really have a financial model that was going to get them from here to the next 20 years. So our concern and our real drive after the end of this grant is that it cannot be obviously driven by single disease response. You have to look at the health systems in these countries, especially faith-based healthcare, because often the funding comes in and it's going to the Ministry of Health, and the Ministry of Health is funding their facilities. And the question is, who's keeping an eye on faith-based healthcare? And so our concern is, how do we make sure that faith-based healthcare in these countries really gets the resources so that it doesn't stop, and also that it starts thinking of itself as a viable organization, so it thinks about its business model. So one of the things we've started thinking about is how do we bring the knowledge and capacity of Catholic health here in the US to have dialogue with those kind of hospitals overseas to say, no, you really can do this. You really can make it viable, but you've got to think about talking to the government. You've got to think about how do you professionalize. You have to think about where are you headed and how are you going to get there. So you can't just live for today. You have to live, thinking about the future. But I think those aren't uncommon problems. If we went back 50 years here in the US, we'd probably find the same problems in Catholic health care here. And so it's maybe a developmental stage, but our hope is that Catholic and faith-based healthcare in the developing world can continue to exist. Otherwise, I think it will be for the detriment of all of us.
How do you make decisions about, with the limited amount of money that you have as CRS? I mean, it's plenty, but it's still a limited amount, where you want to go, where you want to intervene? I mean, we all know relief and development, and we all want to be more on the development side, more on the prevention side, more on the sustaining side, but there's also these crises. How do you, as an organization, as Vice President for International Operations, how do you make these decisions?
Yeah. Well, I think one of the ways we make these decisions is maybe part of this conversation tonight, which is that we're called to be there. Okay. So we understand that call is not one that you can ignore. If communities are sitting in Sierra Leone and Liberia and Guinea and really not having that sense of their human dignity and what they need in that community, we may not be the people that go in like Doctors Without Borders and run treatment centers, but who's thinking about those women giving birth who no longer have access to a hospital? Who's thinking about those families that normally get their food every day because they trade on the street and now they're under house arrest, basically, effectively, and cannot go out? So I think you're right to point out that we can't be everywhere, but we also feel that we can't also not stretch ourselves when the needs are real, to not stand up and try and do as much as we can. I do think we also try to figure out where is the place where we add the most value. We do not have to do everything, but we do need to do some things. And so it's how do you take a step back, looking maybe at that integral human development approach, looking at the spiritual aspect and say, where is the space in this environment for the church to be present? And where there will be other actors maybe in other spaces, but there will be very few who will take this on. So if it's educating refugee children in camps, because no one else is doing that. They'll run the camps, but they won't do the education. Or protection for children in camps. Maybe they'll do all those other nice things, but they're not thinking about child protection. Or it's how do you help families recover together? How do you make sure that shelters keep families together and they're not building shelters that break families apart because there's no room? So I think that's where we see our space. We're very realistic. We can't do everything, but what are the things that we, as our mission, as this part of the church, calls us to be there?
Good. All right. Looking at my watch here, I want to ask you a final question. And I'm not going to do, everyone has to answer the same final question. I have different questions for you.
Okay.
Father Snyder, I'll start with you. Projecting 25 years from now, where do you think will health and social service agencies that have a Catholic anchor be? The business model will change. The square will maybe be a rectangle or something, a circle, or whatever it's going to be. But where do you think we're going to be? Because when you think about higher education, it will be completely changed in 25 years. Where are your kind of agencies going to be at the time?
Well, that's a great question, and I'm not sure I can answer it because there are so many factors that play into who we are, what we do, and how we do it, that a lot of what we do is responding. Although even though we try to be very strategic and look at our mission and say, if this is our mission, who are we called to serve? How can we best do it? Obviously, the best thing would be for us to say, you don't need us in 25 years because we've been so successful.
That's what we're saying in social work.
Yeah, that would be the best thing. It would also probably be delusional, as you said earlier.
We wouldn't have any jobs either.
Yeah. So to me, it's I think, more a matter of looking at what we're called to do, what the mission is, and trying to make sure we use that lens to respond to the situations that we're trying to confront. I think it's not only providing services, it is that advocacy model We have to advocate for a more just society, a society where opportunity is for everyone. That would be the best thing, I think, if we could get a culture in this country where we really do feel we have a responsibility for each other, that connection to each other is not only accepted, it's respected and valued, and that those become the building blocks then of what we are trying to do. Again, I think you talked about the spirituality here. I think there is a very definite spiritual element to the people that we serve, and it's for many of them, it's their greatest asset is their faith, because they live in a daily routine of survival. So they're very, very clear on their need for God, probably much more so than most of the rest of us. And yet, to promote that, not only in them, but also in ourselves, in our professional development, which will, in fact, assure that the Catholic nature of what we do is constant. So I can't be much more specific about what it would look like, but I think we'll keep responding. We've changed very dramatically from where we started in this country to where we're at today, and I think for the most part, in how we deliver services, it's been a very good evolution of that. So hopefully we will continue to evolve, because we're never going to arrive at the perfect model.
Thank you so much. Catholic Charities and Catholic Relief Services are fantastic partners for our School of Social Work and for many parts of Boston College. But I'm especially pleased that Catholic Relief Services, the global arm of these services, is now becoming a much more important partner for Boston College. Also thanks to some advocates on the local level here. But Boston College, I think it's fair to say, Father Monin, started relatively regional, parochial, became a national player, but I think it's time that we become a global player. And what better partner could we have than Catholic Relief Services? It's perfect. It's a perfect partnership, and I'm so delighted that we're engaging in potentially a CRS Global Campus initiative with the president and different units. So I have a question for you, Michelle, as your final question.
Okay.
Why would anyone engage with the kind of work that you do? Because you actually send people to really dire circumstances.
We do.
I'm telling my students, we're not going to send you to all these, and we're going to send you to some safer places. And they play with us.
Okay.
So why would anyone engage with CRS? Or the other question, why would anyone fund CRS? Why would anyone sponsor CRS as a donor, as a contributor?
Okay, great. One of the things I tell people young in their career with CRS about how to tell that you're doing really good in your career is that we keep sending you to worse off places than the place you were last in. So you think it's really bad, you're sitting in Zambia and you're like, oh man, this is really bad, but maybe it's okay, I can manage. And then you get an offer, and we say, well, actually, we want to send you to Eastern Congo on the border, and all that. And then they'd say, oh, that's okay, I can do that. And then the next request you get is like, we want to send you to Darfur. We want to put you in the middle of like, how do you respond there? And you're like, is this a good sign or is this a bad sign? And we're like, yes, this is a really good sign. And when we send you next to the middle of Liberia on the Ebola response, that's actually the best thing.
So its punishment is you send to Geneva, right?
Exactly. If you get sent to the middle of Europe or Amsterdam, you're like sunk. No. So I think that the answer is, where do we need to be? We need to be where the most poor and vulnerable are. Where are the most poor and vulnerable? They're not sitting in Geneva. They're sitting in the places, and that's where we want people who work with us to want to be. If you don't want to be there, then we're maybe not your partner. There are organizations that spend their entire budget sitting in capital cities providing trainings to people who can afford to get to their trainings and get sitting fees. That's wonderful. That's not us. So if you want to go to the middle of nowhere, where maybe you'll even see a lion while you're doing a food distribution, then yes, that's the kind of place, this is the kind of organization you want to work with. I think the reasons why people should donate their time and treasure and be involved with CRS is because we are the Catholic Church. We're yours. It's not us, it's ours. How do we as Catholics and people of goodwill in the United States take ownership of our organization that is out there in the world, bringing a message of hope, changing people's lives? Own it. Own it by participating, whatever that is. You know, we have a saying, pray, learn, act, give. It doesn't really matter. You can do all of them. You can do one of them. There's no requirement. But I do believe that if you are Catholic in the U.S., you should learn about us. We may be the best kept secret. Maybe there's other best kept secrets in the church. But our work, I think, is really important.
Sounded like she has an application form for me.
Exactly.
Did you accept all the
Darfur.
people? Okay, good. I'm good. Father here, for you the question. You have been on many panels, I assume, in your life, and and then you're used to these kinds of last final questions. And I wanted to ask you to share something with us that you always wanted to share with a group of people like us at the end of an evening. Something that the moderator never came up with because they have no fantasy and no
I tend not to go on panels that ask those kind of questions. Well, I mean, I guess in terms of what we're doing here tonight, you could maybe share different things with different peoples at different parts of their life. But in terms of what we're doing here tonight, we've been talking about the institutional outreach of the Catholic Church at the local, national, and international level. And I always say the Catholic Church is institutional by nature. We started down this road very, very early. I think it's right at BC to quote John Courtney Murray. Murray said, at the very beginning of the Church's life, the Church was more than an idea, it was a thing. And what he meant when he said the Church was a thing was that it was an institution that would claim public ground. Now, when you were living in the Roman Empire and you started claiming public ground, that was asking for trouble. Because the Roman Empire figured it owned all the ground. And so the Church immediately started to claim public ground, public space. And so from that, we then began to build institutions in order to fill out the public ground, in order to serve the society, relate to the society and the state, set limits on the state and complement the state, set limits on the public sector and complement the private sector. Now, those are the institutions, and I think you can't really be Catholic if you don't understand that institutions try to change life for centuries, not just for today and tomorrow. And that's why we keep building institutions. They change things over time. We don't start from scratch with every new generation. So that's the institution. But if you ask me, to speak more generally, I think the important thing is the vision of Catholic social teaching is not exhausted by its institutions. The vision of Catholic social teaching belongs to the Catholic community. And so what you don't want to think is to have the community think we're handling poverty because we've got Catholic charities, we're handling healthcare because we got hospitals, and we're handling international relations because we get CRS, or international development and relief. You don't want that to be done. That is one way that the Catholic social vision takes shape. But again, to go back to the community as a whole, the vision belongs to the community. What kind of citizens Catholics are, what kind of professionals they are, what kind of participants in the public life of the society. To be Catholic is to be concerned about the public good. It is never enough to be concerned only by blood ties, only by personal interest, only by the things that most interest me. Not everybody can do everything, and that's not the case. Different people have to do different things. But if the vision is owned by a community, then the community and its institutions are complementary. And that gives you the best chance to, in a sense, stand forth in a society. Share the best resources you have. Speak for the issues that you may have a distinctive position on and maybe a minority position in the society. That means that there's just a lot of work to do. That kind of thing belongs to the community as a whole. And so what I'd never like to see is the social vision related only to its institution. But I never like to see the social vision without the institution, because they give us a capacity to do things, again, over the long term and for the good of many, many people.
Wasn't such a bad last question. I mean, came a lot of stuff out of here. I hope you enjoyed this evening as much as I did. It was a fantastic panel. I think it's taped if you want to hear it or see it again. But I want to thank C21 for organizing this and inviting us, and have a good, safe trip home.